want to share with you the experience of Rwanda. Rwanda, we used to call that is the land of 1,000 hills. I know France have been there, Samil have been there, so you already come to the country where you'll be seeing a lot of hills. So in Rwanda, we have a country with around 12 million of population. I may say that is young population because um, the population which represent 80% is under 35 years old, and we have the four official languages, which is English, French, Kinyarwanda, and Swahili. So I'd like to see the next forum, the next conference, to have country Rwanda as country in one of the implementation countries, because we also belong to Francophonie. So the per capita is around 730 per capita. The governance in terms of e-health. At the center we have the Ministry of Health, which is the policymaker, which we control everything related to health and especially for technology. But we do have other implementing agency like the Rwanda Biomedical Center, which is the implementation agency for the health-related policy and strategies. It's the institution which is under the Ministry of Health. But again, we have the Ministry of ICT, which is the overall ministry for policy and regulation for IT related. So that's why it's one of our key collaborator. And then we have development partners like UNICEF, WHO, Gavi, Gate Foundation, and other development partners. And within the ministry, we have the unity of e-health, which I represent. I'm the head of that unit. Then, how is the Rwanda health system is structured? At the bottom, we have the community level, which is the lowest administrative. The first column is the administrative structure, where we have around 15,000 cell villages, sorry, and then around 2,000 cell sector, district, and provinces. And at each level, we have the structure which help us to control what is happening and to support the population. The lowest level, we have the community level, where we have around 45,000 community health workers who are in charge of treating sick children for under 5 and do sensitization for health-related issues. And we created a new layer at the cell level, which is the health post. We now have around 56 health posts across the country. And then the next level is the sector level, where we have the well-equipped, where the group of people who are under the Ministry of Health, who are paid on monthly basis, because the lowest level, where we have the community health workers, they are volunteer, they are not paid on monthly basis. But at the health center level, which is our sector level, we have a group of people who are committed, who work for the government and who are paid on monthly basis. The group of data manager in charge of community health workers, the nurses, and some visiting doctors who are giving treatment. And then the next level is the district hospital, where we have then the doctors, sometimes the specialists, and so on. We have around 30 districts and around 42 district hospitals, which means that in each district we have at least one hospital. We have some exception where we have more than one hospital, but at least in one district there must be a hospital. And then the highest level is tertiary hospital, the referral or teaching hospital. We have around 5, and they are specialized serving Trinity medical treatment. And then why we started the e-health, how is it integrated in national program, in national policy and strategies? In Rwanda, we have what we call Vision 2020, and is the vision where we want the country to be in year 2020. And with that vision, we created what we called Smart Rwanda Master Plan. And then Smart Rwanda Master Plan, one of the 7 pillars, the first one is the health, smart health. So this is, I bring this into your attention to see how the government of Rwanda is supporting the e-health in Rwanda, and how even is integrated to the national policy and strategies. So smart health is one of the 7 pillars of Smart Rwanda Master Plan. But then we may ask ourselves, what is e-health? We simply define in Rwanda as the use of technology to support healthcare delivery. Of course, those doctors who are using the tools, they have to take some decision, but based on accurate and timely and relevant information. And you want those systems that are interoperable and to have a clear, defined standard and interoperability to have the system talking to each other. And then in Rwanda, we came up with the Rwanda e-health framework to see what we want and how to want to approve and so on. So we have the key foundation component, which is the health information exchange. And we have to get the infrastructure, computers, servers, mobile phones, and so on. And then with those infrastructure, we have to get some personnel to develop those different systems and to maintain it. But to have the system is not sufficient. We have to get the policy and standard and security measure. Some people were asking about the security and so on, but in Rwanda we have a policy where we oblige all public institutions, especially in health sector, to store and to host all data or other application in national data center, which is a secured place for disaster recovery and even where we can monitor or control the security of them. And also when it comes to the health related, many people are interested in data. So many people are coming to see us, can you share the information and so on. Before we receive all the requests, but before we give you any information to share with you, we have to sign the data sharing policy. So those are the part of the e-health policy. And then we have to sustain, and financially, the government of Rwanda is putting some money, but we are working with our development partners to sustain our systems. And then the e-health governance is one of the very useful part of the e-health, which is the e-health policy, e-health unit, sorry, and we have the e-health technical working group, the forum of technical personnel, where we meet regularly to discuss and to present the new initiative, what to adopt and the challenges that we may be facing, and to share the experience. It's a forum where we meet the Ministry of ICT, Ministry of Health, development partners like UNICEF, WHO, MSH, and other partners. So I'm the chair of this forum, and the co-chair is one of the development partner, which is CDC, and it's a very useful forum that it's helping us. And then we have 7 pillars. The first pillar is about electronic medical records, which is a number of systems that are individual based. And the second one is for telemedicine system, where the doctors, patient, all in remote area can talk to each other for treatment. And then we have the routine HMIS and disease surveillance, where we have the system that will come after to see what is happening in different health facilities and so on. And we have resources management for medication, for people who are working in health sector, and others. And then we have data warehouse and information portal, the portal that we want to access for the public, so we can share the information that are verified, analyzed, and approved by the Ministry of Health. And then I would like to share with you some of the e-health installation that we have. The first one is the rapid SMS, the mHealth application that we first ever used in Rwanda, and which is very successful with the system that is being used to save lives of pregnant women and newborn. As I mentioned, the lowest level administratively, we have the community level, the village level. And in each village, we have around 3 community health workers, and they have been given funds, and they are looking after the pregnant women and newborn lives, and they have funds, and whatever that is happening to a pregnant woman or newborn up to 5 years, they have to report. They just text an SMS and comes directly to our central server, and they get notification, yes, we received, and so on. And then the good thing for rapid SMS, it's when there is, for example, a danger, anything that is not happening well for a pregnant woman. For example, there is a bleeding pregnant woman and is at home and during night, or the pregnant woman started the labor and is at home. So They just text, and the Ministry of Health, the health center where she's from, and district hospital, they are notified by phone, by SMS, so they can take action. And we located a number of ambulances which may be near that pregnant women, and if needed, they send the ambulance so they can pick the pregnant women and they bring to the hospital.
Voici la télémédecine et ce qu'on en appelle le e-learning. Nous avons plus d'une trentaine d'hôpitaux qui sont connectés. Nous avons tout le matériel nécessaire. Ceci nous permet d'être connectés à 2 universités américaines qui travaillent avec nous. Et nous organisons un certain nombre de réunions, de séances par visioconférence, nous permettant justement de voir comment nous pouvons avancer dans le domaine de la télémédecine. Je voudrais également insister sur le contenu de certaines formations qui sont proposées, par exemple, dans les hôpitaux pour les soins, les premiers soins, mais nous avons également des installations qui s'occupent plus particulièrement de malades atteints du sida. Et nous avons la possibilité d'enregistrer toutes les données de ces patients lorsqu'ils arrivent à l'hôpital ou dans les centres de santé, de façon à être sûr qu'on peut les envoyer voir les spécialistes requis ou avoir les tests nécessaires. Lorsque ces patients, hommes ou femmes, viennent à l'hôpital, à ce moment-là, nous pouvons les suivre grâce à cet enregistrement des données. Donc, moi, ce que je voudrais dire, c'est que nous avons une application qui est le RHMIS, qui est un système de gestion de la santé et gestion de l'information, surtout que nous avons dans le domaine de la santé, et qui est proposé à tous les centres de santé. Vous le savez, je l'ai dit, nous avons des centres de santé dans de nombreux différents secteurs, et par conséquent, tous les mois, il doit y avoir un rapport envoyé par ces centres de santé, par exemple, combien de décès, quelles sont les pathologies les plus présentes, c'est-à-dire toutes les données que l'on pourrait appeler de routine et qui nous semblent importantes, qui nous permettent d'avoir une vision générale concernant les différentes communautés du Rwanda. Donc, c'est une application qui est accessible grâce à Internet et qui donc permet à tout le personnel d'être informé en temps voulu et afin de savoir aussi ce qu'ils doivent faire lorsqu'ils sont confrontés à certaines situations. Un autre projet également, c'est le projet RHEA. C'est un projet d'échange d'informations dans le domaine de la santé. Nous avons un système de données. Et comme tous les autres systèmes, évidemment, il faut y avoir un certain nombre d'installations. Et c'est pour cela que nous avons pensé qu'il serait intéressant d'avoir
creating new health centers, so we can update that registry and then it can automate the rest of the system instead of going to the every system and we update. And the same case for current. We have patients who are attending the hospital. It's not yet connected in centralized server, but that's our future plan. So we want all facility to have the unique identifier, and the facility, we need to know what are the specialties who are in different hospitals, so we can know even if we want to refer, so we can know we want the right personnel in that facility. And we have interesting shared health records where, for example, a patient may visit different facility to know what is happened with the previous visit in different hospital. We are using shared health record. And at the center, we have the health information mediator, which is the interoperability layer. And then, what are our future plans? In Rwanda, we are the first country to adopt the use of drone in healthcare delivery. So the future of healthcare is out for delivery. We are starting using drones. And as I mentioned, we are working with other institutions, national identification agencies, because we currently have the national identification for 16 and above. For under 16, we don't have identification. So we are working closely with the NIDA so we can have the social security number for Rwanda. And we want to have civil registration and vital statistic. When the newborn are born, they have to be registered directly. When they die, they have to be registered, because the health facility is the entry point and end point for most of the population. 95% are born in health center, and even those who die, most of them are dying at the hospital. And those who die in the community, we have those community health workers who are able to report back. I wanted wanted to share with you the key challenges, the people, process, and system for groups. The people, we still have some resistance of the healthcare provider with the low literacy. And processes, it's very hard sometimes in some country to maintain data quality and spend. The system sometimes, some system operate easily. They don't have interoperability led, but we are working on it, especially in health information exchange. And then technology, the not stable power backup, and the cost of broadband connectivity, even if the government is there. So one of the key factors of our success, it's very hard to have a president of the republic come back to say thank you for those community health workers. It's one of the big activity, big chance that we had to have His Excellency Paul Kagame, who invited all community health workers to say thank you for the good job that you are doing. Thank you very much.